Professor Neil Quigley, the Vice Chancellor of the University of Waikato. Professor Quigley, lovely to have you on the show. Welcome.
Good morning, Michael. Thank you.
You must be happy. I mean, if National and ACT get in, you've got a new medical school at Waikato University. That would be phenomenal for your university, wouldn't it?
It would be great. But more importantly, it's a great opportunity to be able to bring a new model of medical training into New Zealand and to have the opportunity to help deal with the health workforce crisis that we've got at the moment.
Did you have discussions with Christopher Luxon before he released this policy?
Yes, we did, because you'll remember that the proposal that we have a medical school at Waikato goes back 7 years. So we worked on a detailed business case at that time, and the door has always been open for people to talk to me about it over the intervening period. And so obviously Shane Reti and Christopher Luxon picked up that opportunity over the past 9 months or so.
So obviously for them to have made this sort of commitment, and it's a huge commitment in terms of not just funding, but in terms of, you know, a third med school, which is extraordinary really in the history of New Zealand medical training. Why did they choose Waikato, do you think? I mean, I know that you'll obviously have a booster view of it all, but why Waikato in specific?
Well, there's a number of reasons. One is that Waikato Hospital is the largest single hospital in New Zealand, and so there's a considerable resource of senior doctors there who would be available to help with the training of medical students. It's also that our critical shortage at the moment is in primary care, in general practice, especially outside of Auckland, Wellington, Christchurch and Dunedin. So coming to Hamilton, where we have access to all of the rural and provincial centres around the centre of the North Island, makes good sense in terms of selecting people who want to practice medicine in those sorts of places, and indeed that's most likely people who already live in those places or whose families are based in those places. Right.
But then the next question would be, when could you start training doctors were there to be a change of government in 100 days?
Well, we've indicated that the first intake of students would be in 2027.
Wow.
And that's because, you know, to set up for a medical school is normally thought, if you look at overseas models, to be a 3-year process. We would need to get accreditation from the Australian Medical Council before we could take in students, and that's likely a 2-year process. And I would need some time, obviously, to hire some key people and start working on some of the facilities that we'd need, as well as establish the partnerships that would be a base for the program as well.
There's a budget for this?
I think because we've been working on it for 7 years or more, there's substantial support out in the community for the establishment of our medical school. So from the point of view of the challenge that Christopher Luxon has suggested, that we would need to raise $100 million over 5 years, I think that's doable. And I have no real insight into the fiscal envelope that National is working with in terms of the promise they've made, but I assume that they've done their homework on that.
Okay, you've also, prior to being the Vice-Chancellor of the University of Waikato, were a professor of, or you probably still are, a professor of economics. Tell me why, okay, so it's going to take 4 years from now, 24, 25, 26, and then you go 27, 3.5 years from now, to get Waikato Med School up. Why wouldn't you, because I haven't got a particular view on this, but I'm interested, just simply boost the intake at Auckland or Otago and be up much quicker?
Well, that process of boosting the intakes of the existing schools is part of everyone's plans as well, as I understand it. But the key thing, Michael, is that our critical health workforce shortages are in primary care. And at the moment, a very small proportion of the Auckland and Otago students choose general practice or other primary care specialties once they've graduated. So it's not really just about a third medical school or even the time. If we want in the future to have a health workforce that really is available to fill the gaps that we've got, then we need to start a training model that's really likely to deliver that. And the sort of graduate entry program focused on selecting people who really have a commitment to primary care is the sort of program in Australia and in Canada, in the UK, where you find they do get very high proportions of their students choosing general practice and other primary care specialties.
So you're saying that your med school, if one starts up at Waikato, will have a different philosophy but also a different selection process than the other two, because it'll turn out more GPs than than Auckland or Otago?
That's correct. And because it's graduate entry, we'll be selecting students when they're, as a minimum, in their early 20s, but probably for many of them in their mid or late 20s. So they'll have had an opportunity to decide really why they want to be doctors, and for us to be able to get them to articulate their commitment to primary care as an occupation.
Now, what you're saying to me now, I haven't seen in the mainstream media, and I don't think has been widely reported. But obviously, it's going to take some selling on your part, because you can expect that Otago and Auckland are going to get a bit miffed, aren't they? And given that if there was a new government, probably be arguing against a third medical school, yes?
Well, that they may. I can't speak for them, obviously. But all I can do is say, I think, the record from other countries like Australia and Canada is very clear. The international literature on medical workforce training now is very clear, and it's entirely in line with what we've suggested.
All right. Now, and the other aspect about that, I'm intrigued, you just said then, I didn't realise, is that you're actually going to be taking postgraduate students, so they've done a degree in something else before they come to Waikato Med School, is that right?
That's correct, yes.
What numbers are we looking at? What sort of intake would you be thinking in your first year, 2027?
They've committed to 120 places for a start, which is probably as big as a new medical school can be for a start. It might, over a decade grow above that number, but 120 for a start. All
right, 120. How long does it take to train a med student, a postgraduate med student, as you've said, from 2027? When would they graduate and be available for the medical workforce?
4 years for a graduate entry program, and that's working on the model that is used at University of Melbourne, University of Sydney, Queensland, University of Queensland in Australia. Many medical schools internationally use that 4-year graduate entry model.
Okay, so the first time that those people would be out there practicing in the workforce as a junior doctor, presumably, would be 2031. That's 8 years from now. That seems an awful long time to somebody like me, and I guess to you too.
Yes, that's right. We're a similar age. So it is a long time, but Michael, it's a bit like the old story about the best time to plant a tree. It's either 30 years ago or today. We've known this health workforce crisis was coming for a long time, but the forces of conservatism around the country have said, no, we shouldn't do anything different. We've just got to start doing something that's different. And so I'm delighted to have the opportunity to be the one who helps with that.
And finally, it's no, mistake that Waikato's or Hamilton's been chosen. You've got two marginal seats, I guess, but at the end of the day, it's party vote rather than seat by seat these days. But also, your population around Waikato and Hamilton would be very strong. Yeah, I mean, you're really meeting, if you like, a demographic need as much as anything else too.
That's right. The population of Hamilton's growing very quickly. It's clearly a city of the future, but we have the benefit, as I said before, of a very large hospital that serves a very large region. And of course, around the region, we've also got quite a number of rural hospitals which are ideal for development as regional clinical training hubs for our students. So there's a real capacity in the core region for us to do those sorts of things that we've talked about.
When this announcement was made yesterday afternoon, I guess you would have got some prior notice, obviously, but what was the reaction like amongst your academic staff to this news?
Well, again, the team at the university have known we've been working on this sometimes more explicitly and sometimes more quietly over the last 7 years. And of course, being academics, there are always people who have their own views. But broadly, the university's very supportive of this move. Our health programs are developing very quickly. We've got a great new nursing program over the last 4 years, which has grown very quickly. And so we're feeling very confident about our ability to make a contribution in the health space.
Well, thank you so much for joining us. This is exciting news. Obviously, the proof's in the pudding. Lots of politicians make promises. And on that one, Neil, you're confident that should there be a change in government, that this will be in the budget next year?
I am confident, and of course that's the great thing about the announcement yesterday. Despite I'd had some discussions with people from the National Party, but when they stood up yesterday and said they were definitely going to do this if they're the government, then that's my assurance that we're on the road should that eventuality come to pass.
Neil, thank you so much for joining us. I wish you well.
Thanks, Michael.
You've got a very interesting ahead of you. Thank you. That is Professor Neil Quigley, the Vice-Chancellor of Waikato University. He'd be privately doing cartwheels, I imagine, particularly spent 7 years on it. Interesting, though, that the first graduates wouldn't be for another 8 years. So what do we do with the public health system in the meantime? And I've got in front of me here, Training More Doctors. It's the 3-page press release that was put out from the National Party. It was emailed to me yesterday afternoon. But I've got to be honest with you, there's nothing in it for the short term. The National Party said that we need 1,000 more GPs. That's what they think, 1,000 more GPs. And they've got to stay GPs too. They can't become specialists. But I'll tell you what's missing. And it'll be fascinating. Maybe Miles, you can bring Miles Davis after 10 o'clock because he's coming up straight after me now. But I'll tell you what's missing. There's no bonding here. So I could still train these guys at Waikato University and they could still head off to general practice in Australia, the United Kingdom, Canada, or the United States. It's the missing bit